Tracy, or Miss Holt made me a PowerPoint with my 9-year-old. So I'd like to thank them. But my name's Regina, and I'm a registered dental hygienist. How do I click it for it?
The arrow.
There's lots of arrows, you guys.
The one. There you go.
Okay, so my educational background. I graduated from Cheatham County High School in '05. This is going to kind of age me. And I did not know what I wanted to do. And I thought that I was supposed to go to a 4-year college. So I applied to one. I wanted to go to UT Knoxville to just get out of my hometown. I wanted to be a little further from home, but not so far that I couldn't see my family. And I just took general education courses, and I didn't have an end goal. I had no idea what I wanted to do. And as far as the question earlier, I did party too much. I did not go to class like I should have. It was your typical small town girl, and then had way too much freedom. And I made some bad choices, and I want to be honest about that, to encourage you guys to go to class. Because my story is, it's a lot harder to go back when you're older. It is, but it all worked out for me. But so there's a gap here from '05 to 2015. So what I did, I met my husband at UT Knoxville. So it wasn't all a loss, okay? And during that time, I worked in restaurants. I got into social work. And I started out there as an administrative assistant, and then it was a foster care adoption agency. So I worked with the foster parents. I did some trainings there. I jumped around all over the place, and I was interested in psychology because I thought that I wanted to be a therapist at that time. I enjoyed giving back. I liked talking with people. Then I realized I needed to have a master's degree. So I thought, I don't want to go to school that long. And also, my first daughter was born in 2015. So that kind of changed things. So how I got into dental hygiene, let me see what's next. I'm clicking. How did I get into dental hygiene? So after I'd had my kids, I wanted something for when they got older. I stayed home with them. I wanted to stay home with them when they were little. And my husband, he always knew what he wanted to do, and his job thankfully allowed me to do that. But when they got older, I wanted to go back to work. I really admire moms who want to stay home with their kids. But for me, I wanted something that was just for myself. So my honest answer to that question, dental hygiene was not something I had ever considered. Wasn't something I always wanted to do. I hated going to the dentist growing up. Never considered this as a career. I Googled least amount of school, most amount of money. That's what I did. And nursing came up, and dental hygiene came up. This is at TSU. Tracy.
Just pass it.
So
You're gonna talk loud, G.
Okay. I had to take prerequisite courses. I went to school for dental hygiene for 3 years total. First, I had to take the prereqs. You take, microbiology, anatomy, physiology, and you needed those general education courses, which luckily I had from Nashville State when I went for psychology, got that associate's degree. Had a little bit of courses from UT that transferred, where I jumped around forever. So I still needed to take, I don't want to say random, but I had to get those prereqs to apply at TSU for hygiene school. This is Dexter, okay? He's kind of creepy looking. He is who I learned to take x-rays on. I did not practice on people because I did not know what I was doing. Question?
Why is he stereotypically Asian?
What's that?
Why is he stereotypically Asian?
I'm not going to answer that one. Yeah.
Why weren't you allowed to practice on people?
I did eventually, but when we're first starting out, I should not be trusted with these very sharp instruments on people. Tiny little knives, and it does take precision. Yeah, I had no idea what was involved in dental hygiene. I thought I was just going to go in and clean teeth. It turns out it's a lot more involved in that. The prerequisites for dental hygiene are the same as they are for nursing. You have to hold the instruments in a very precise way. Did not know that either. It was a lot. and also had kids during this time. So this was my journey. It was very difficult. I cried a lot. I threatened to quit a lot. When I went into dental hygiene school, my third child was 2 months old. And I knew I wanted another one too. My husband thought I was crazy. So also in the program, I planned and got pregnant with my 4th child. So yeah, I wanted to quit, cried a lot, but I knew I couldn't quit for my kids, and it was something I really, really wanted to do. So this is my 3rd child. This was my class. And there we were at a training, I think. And I met my best friend here, who's now my neighbor, lives down the road. So I made a lot of really good friends there. We were all going through the same thing. Some people didn't like as much, but kind of like what was said earlier, you're going to click with some people not. But we had our group chats too. So those things, you are all, whether you like each other or not, you're there to help each other out. It was said too, like doing things that you like. I drew some cartoons through school. I just have always liked to draw. I've sold some on Etsy, Facebook. Not so much time now with the kids, but I'm trying, you know, like I just dabble in this and that. But I am certified to do local anesthesia. So I'm going to come in and numb you so that you can't feel when I'm going under your gums to clean out things that cause gum disease. But first, I practice on hot dogs and oranges. Yeah, so here I am saying, you know, don't worry, I've had a lot of practice. So we practiced on each other during hygiene school, and you just really hope that your partner studied the night before and knows where to hit that nerve. Luckily, I was pregnant through part of that, so they could not inject me. But after I had the baby, I had some catching up to do. So that was really fun. There's my orange, and here's the anesthetic. You learn about equations to do to calculate that for certain people. So some math involved, and you learn what to check when you're going to give injections on patients. There I am about to deliver. I had a baby a month before I needed to take the board exam. So I had my baby and graduated in the same month. It was terrible. It really was, but this was the hardest thing I had ever done, I'll be honest with you. But you can do whatever you decide to do. You don't have to know what you're going to do right now. You really don't. And you can do a little this, little of that, and you'll be surprised what you end up doing. I love what I do now, and I never thought that I would end up doing that. So there I am having contractions, trying to remember stuff, studying for the boards, thinking I can't do it. But right here it says you can do it. So I did it. There's me with my youngest. That's Gianna, Alex, Barrett, Everly. All the girls win, and so Daddy is outnumbered. And there's me in my little white coat. So I did graduate. After you graduate, you do have to, you still have to get licensed. You can't just start taking care of patients. You will take a written board exam, and you'll do a clinical exam as well. During that time, it was COVID, so we didn't do our clinical exam on actual people. We had to do them on, it's called a typodont. It's like a fake mouth, and they'll hide stuff underneath those gums there. If you tear the gums with your instrument, you fail. Like, it's very nerve-wracking. Like, I was scared the whole time. But you have to pass both of those board exams and apply for your license. X-rays. How do you use tools such as the X-ray? How does that apply to your job? I am not allowed to tell a patient, hey, you have a cavity here, here, and here. But I know when you have a cavity here, here, and here. So I will tell the dentist. This is your bone level right here. These little specks, I don't know if you can see them or not. Those are underneath the gum. And when I'm numbing a patient, this is periodontal disease. We'll have these little specks under the gum that I've got to go down and get out of there so that they're not continuing to lose bone, lose teeth. We don't want that. I want my patients to keep their teeth, okay? So I can go in, that's an implant. I'm evaluating the bone level. I'm looking for cavities. I use x-rays all the time. This one, those are called bite wings. I take them on the sides. I really like, it's called a panoramic x-ray. It'll show me your jaw, it shows me your spine. We have really good technology in our office that'll show me your airways so I could know if you might be prone to sleep apnea and send you to a specialist. So dentistry's come a long way. I'm really passionate about it. I really ended up loving it. How much writing does your job require? A lot, actually. After every patient, I've got to do a clinical note about the patient. I'm going to review their medical history. I need to write any changes about that, especially if I'm giving anesthetic. I need to know about their allergies. I need to know blood pressure. I'm not going to give a patient who's got high blood pressure epinephrine because it's going to speed that up. It's going to raise the blood pressure. And I want to document everything because if there is an incident and I have to end up in court because something happened, I've got to cover myself on that. So your notes, I want to make sure I'm very thorough. So yeah, I'm writing every day. Are y'all laughing at me? Are you laughing? Yes, you are.
No, it wasn't. I promise.
I don't believe you. I hear her laughing.
She said you're the spicier version of me.
Oh, how much reading is required in your job? It's a lot. I'm reading their charts. I'm seeing what's going on about the allergy, whatever they've got going on. I'm trying to review the charts. I read every day, I write every day, and I talk, as y'all can tell. What communication skills are required in your job? I love getting to know my patients. That's my favorite part. I've always been a people person, whether I was waiting tables, whether I was visiting foster families, and now when patients are in my chair, because they're not going to listen to me about flossing or they're not going to care about what I say until I make that connection. So I've always thought relationships are first. So communicating with the patient, it's just like communicating with you guys. Y'all aren't going to care what I say, but when I get up here and I tell you about my family, I tell you what I've gone through, you might care a little bit more because you feel like you know me or you know my journey a little bit. So that's kind of what I like to do with my patients. And then I'm going to communicate what I know and how I can help them with their oral health. I don't know if that makes sense, but what skills are required? Listening. I got to listen to where they're coming from. What are they there for today? What is their number one? What do they care about? Do they care about how their smile looks? Is something hurting? What's our priority here today? So listening, active listening. My typical day. Coming in, I chart. I review every patient's chart. I'm going to see when they last had x-rays, what x-rays they need, what medical allergies do they have. For artificial joints, say somebody had a knee replacement, they're going to need a pre-medication because when I'm getting in there and I'm stirring up blood, that bacteria can move to that artificial joint and cause an infection, and they may need to have that replaced or have an additional surgery. Or, a kidney transplant, they need a pre-medication. So I've got to review all of that. Review charts first, set up my room. I like to chit-chat with my friend, so I try to get my stuff done pretty quickly. But we have a morning meeting, morning huddle, where our dentist will come in. They'll tell us what to expect for the day. We wear little microphones where we talk to each other. That way I can say, hey, can anybody help me flip my room? If I'm running behind, flip just means they're coming so that I can clean up and get ready for the next patient. So we're communicating all the time. Hey, can anybody help out in sterilization? Because I got to run my instruments back when I'm done. So it's very fast paced. I might get done with the patient. I got to clean up all this stuff. It's dirty. You never know. There's bloodborne pathogens. I have worked on patients who have AIDS. You're very careful. You got sharp things in their mouth, and then you've got to clean that room completely for the next patient so that it is safe for them. So I get help when I need it. Hey, I need this room sterilized. And you clean the room the same way you would for a patient with AIDS or any kind of disease. You don't know. You don't know what you may be dealing with. And I'd say that's my number one priority in my typical day is protecting myself and the patient. Being very careful giving an injection, your hand placement, because I know a lot of people who have been stuck with a needle. I myself have stuck myself with a needle before. So it is scary. You can't ever just be careless in what you are doing. Luckily, I was okay, but it is scary. So typical day, safety is first. And it's very fast-paced, but I love it. I don't get bored. My day flies by. Do I have flexible hours? Yes, I do. You can temp I don't do that because I like working in the same office, but you can jump around to offices. I get text messages every day, and they'll be last minute sometimes. Hey, we desperately need a hygienist, $65 an hour. I don't do that, but the rates are a lot higher if it's last minute and they're in desperate need. And hygiene is in such demand now that you're going to have a job if you go to school for it. Oh, I work 3 days a week. And I love it because I work Monday, Tuesday, Wednesday, and then I have time with my kids. If they have some little school event, I will switch my day and I can call on my patients and say, hey, Alex has this little program. Sorry I didn't know about it. Can you move to Wednesday? Or I'll ask another hygienist, hey, and we all work together on it. I had another hygienist, she needed to go to a funeral, so I took her 4 o'clock patient. I love that about it. If I have something coming up, I can mark that week off. I know my patients now. They know all about my kids because I tell them about my whole life. But yeah, it's very flexible. I get paid time off. I get Christmas break. We are closed on holidays. And at my office, which your office matters, but my office, I do get paid holidays. When we're off work, I am compensated for that. So those are things to look for when you're looking for a job. Not all offices are like that. If a patient doesn't show up, sometimes in hygiene, you're expected to clock out. Luckily, I'm not at my office, which I'm grateful for. So yes, my hours are flexible. Also, if you temp, they're even more flexible because you can take that job or not. Travel hygiene is another thing. I have a friend doing that, and he loves it. Favorite part about my job, I think I've already said. I love the people at my job. Kids, that's my son right there. I had to meet certain requirements in school. I had to work on children, people with periodontal disease, gum disease, some elderly patients and special needs patients. And there's different challenges with each patient. My son was very good, thankfully. Some children are not. They won't open their mouths, and you're just trying to clean their teeth, and it can be so frustrating. But once you make that bond with them, or you play with them a little bit, you're showing them the little suction, hey, this is Mr. Slurpee, or then it's fun. So I love the people at my job. Some patients, not so much. But some people are nervous coming to the dentist. You don't know what they have going on in their lives, so I try to be compassionate. Least favorite part of my job, food impaction. And what that means, some elderly patients are just unable to clean their teeth. They have arthritis, Parkinson's, something going on, and food gets trapped for the Lord knows how long. And there is an odor to that can come through your mask. So I don't have that all the time. I don't care about the blood. I don't care about the buildup. I like that stuff. Gotta be a little weird, right? But food impaction does get to me. It does. Luckily, they can't see my face when I'm doing it because I got my mask, but that does get to me. That's my least favorite part. I love everything else, and I don't have to deal with that all the time. And I love little old people. Bless their hearts. I do want to help them, but it smells. This was at a diabetes walk for school, and my fam, I brought him. She's Tooth Fairy. He just does his own thing, and I made my husband be a toothbrush, and I'm obviously that. I don't know who that guy was, but at TSU we went and supported different things in the community. So I did enjoy TSU. There's other hygiene schools in Nashville. South College is good. I've heard great things too about Western Kentucky. Their program is supposed to be really, really great. I can't say too much. TSU was really a challenge for me because we went through it during COVID. And it was really hard because we had to work on each other so much. We didn't know if we were going to graduate, meet requirements, but I'm sure that's gotten better now. What skills are associated with your job that most people don't think about? Pathology. When you look in somebody's mouth and something's off, is it a sign of cancer? Is it a pizza burn? Y'all know when you bite into pizza, we've all done it, Hot Pocket, something like that. Is it normal, or is it something that I need to send them off for? Smoker. I can tell by stain on your teeth, do you smoke marijuana? What color is it? I can tell what my patient is doing. Whether they tell me or not, I can tell if you're flossing or not. And when I ask you and you tell me no, I know if you're lying to me or not. I'm not going to call you a liar. I'm just going to say, okay. But I know. So the skills associated is pathology. I can tell certain things in the mouth and what it means with your body. Diabetes is associated with gum disease. There's certain diseases that can show up in the mouth. So I could say, hey, I think you need to go check this with your provider. Subjects in school, anesthesia, you got to know where you're going. And anatomy, microbiology. Studying for the boards is extremely difficult. I used 2 different things, took a lot of practice tests. Study with a friend, just one friend, okay? Find the girl or guy who's in your class who makes those grades and keeps to themselves and makes friends with them. They don't really talk to anybody. You're not sure about them. They don't come off as friendly. That's the one that you buddy up with. And that's what I did, and she's my bestie now. And we got through it. What advice do I have to anyone who wants to become a dental hygienist? Go to the school's website and print out their list of prerequisites for their dental hygiene program. And then sign up for those classes. And I think you guys college. Do that. Do that. I'm kind of jealous. So that'd be my advice. Any questions? Questions? Yes, ma'am.
I have always wondered, like, can y'all actually tell, like, when somebody smokes?
Yes.
And by the stain of their teeth, like, you can't see anything, like, on the top of their mouth or in, like, the back of their throat?
Sometimes we can, on the top, depending how much they smoke. It doesn't show up for everybody. Depends how well they take care of their teeth, too. Vaping is harder to tell. There's not as much research about that. So sometimes it's hard for me to tell if it's a tea stain, coffee stain. Usually I can smell it. But I don't judge people. I used to smoke. Hardest thing to quit. I've had some people tell me, I'm never going to quit. I've been doing it 50 years. I'm like, okay, well, whenever you're ready, just, we know it's bad for you. And she's like, honey, I'm just not going to do it. Just want you to clean my teeth. I'm like, all right, that's fine. So yes, I can usually tell. Any other questions? All right, thanks you guys.